יושב איתנו כאן אדריאן לואו, שהוא אחד מהחוקרים הגדולים לכאב בעולם. I just pay you a compliment, I want to tell you. ואני אשאל אותו כמה שאלות על כאב. Why is pain, education about pain important?
I think there's a fundamental need for people to know what goes on with them. In any health scenario, people want to know what's going on with me. And when it comes to pain, there's a simple question: why do I hurt? So people need to understand why they hurt. There's a lot of controversy about pain, and a lot of people don't understand how pain works. And we've done numerous studies. We've asked people, what can we help you with? And they say, why do we hurt?
But what about the bulging disc? I'm hurt because of the bulging disc.
Yeah, and so once people want to know about why they hurt, then we got to talk about what kind of things they believe. We currently know that what a person believes and thinks about their pain drives their pain more than anything else. It is by far the biggest thing. So as far as the bulging disc goes, we now know that 40% of people in Tel Aviv is walking around with a bulging disc and don't have any pain. The neatest thing we've ever done in medicine is we scan people who have no pain, and we find things like bulging disc, we find arthritis, we find all kinds of things, but they don't hurt. So pain and tissues are two different things. Mm-hmm. You can have normal tissues and hurt, and you can have bad tissues and not hurt.
How can it be? But isn't that, I've got an arthritis in my knee, so I hurt?
Yes, and again, a lot of it's fueled by the way we've always taught things, the way we've always done stuff. And so we've always done it that way. And so we got to be very careful there, because we always assume this. But we have since done lots more research where we've taken people with, if you want to talk about arthritis in the knee, and scan them, but they don't hurt. So how does it work? Well, it's pretty simple. Pain comes from the brain. The brain decides to produce pain, yes or no. And so in people with arthritis, in some people, the brain decides that is a problem, and I'll produce pain. And other people, the brain decides it's not that big of a problem. And the brain makes these decisions based on the information that it has at the time. And that's why teaching people about pain is important, because we can influence how they think. The bottom line is there are many people with arthritis in their knee that are running marathons. There are many people with arthritis in their knee that's living very fulfilling lives.
So teaching them will change anything?
Absolutely.
Why would that change?
Because the brain makes decisions for us every day. What people don't understand is what we see is a brain thing. The brain takes information and builds a vision. The brain takes sound, for instance, and the vibrations coming in turns into hearing. Pain is the same way. The tissues can only send information, and then the brain interprets it to decide, what do I make about it? And so depending on how you were raised as a child, how you see pain, there are so many things for the brain to decide. Based on everything, this isn't the problem. So I'm not going to produce pain to protect me. I don't need that.
Is there any research showing it's true?
Yes, we have tons of research. We have now done enormous amount of massive review studies, thousands of patients. When we teach them about pain, even though they got tissue problems, we teach them about pain, they understand it, they move better, they function better, they get on with their life, they have less health care for it, because they understand it. And in a simple way is, when people understand why they hurt, their fear goes down, their anxiety goes down, and all of that actually makes pain better. And so, yeah, we have an enormous amount of research that's building in so many different ways.
So if I have a patient, all I have to do is just to explain pain to them?
No.
So why
Teaching people about pain is one piece, and we often would say it's one of the early pieces, right? So if you come to therapy, if you come to medicine, the first thing we have to do is make you understand what's going on. So you understand, well, this is how pain works. But that's one little piece. There is a saying in pain science, and that is motion is lotion. Movement is the biggest painkiller in the world. We have now found out that a 10-kilometer run, as an example, produces 10 milligrams of morphine, the same medicine we inject into you in the emergency room, which means our brain produces pain medicine to calm us down when we exercise. So we teach people about pain, but we exercise. We teach people how to sleep again, because they learn bad behaviors when they hurt. We teach people how to exercise, how to sleep, changing their diet. So teaching people about pain is one out of maybe 24, 25 things we can do. It's critical for people to understand knowing about pain doesn't make you better. It's knowing about pain and then changing movement, function, behavior. That combination is very helpful.
So if I'm a pain patient,
yes,
and I've got a chronic pain, do you think I should go out and run 10 Ks to get
no,
10 milligrams of
because
morphine?
it would hurt, not even close. No.
So how do you do it?
So everything in life has to be scaled. A good example, you wake up one morning and you decide, you know, I want to run the Tel Aviv Marathon. I always wanted to run a marathon. Nobody in their right mind stands up, puts on running shoes and runs 42 kilometers. That's silly. What do? We go outside, we run a half a kilometer, we come back and go, that was a lot. A half a kilometer becomes a kilometer, becomes 2, becomes 3, becomes a marathon. Everything in life gets broken down. So if you're my patient and you haven't done a lot of exercise, it's new for you. We start you small, we start a little bit, and slowly more and more and more and more. So we create the behavior over time. So you go and you run for a half a kilometer, come back and say, I feel pretty good. And then we slowly build little pieces, and this is referred to as pacing or graded exposure over time.
Mm-hmm. And what if I'm that kind of person that get aggravated if I'm stressed, or if I'm tired, or if I'm outside in cold? Do I need to go to do the exercise as well?
Yeah, and the other neat thing that we know about exercise, and again, we can talk about it, I keep telling people, we can probably give you days worth of lectures on the benefits of movement, human movement. We've now found out that when we pump blood and oxygen around nerves that are sensitive, they calm down. The old stories when you were in school and you were studying for a test and you were nervous, we'd go for a run or a bike ride and you come back and say, I feel much better, right? That's what this does. So when we're in pain, when we're hurting, when we're emotionally charged, stress, anxiety, exercise is a way to modulate our mood, to modulate pain, to calm nerves down. By the way, it also makes food taste better, we sleep better, our immune system gets better. I mean, we can go on and on and on. They're all positive things to change our life.
Can I ask you about fibromyalgia?
Yeah.
Okay. What about that? Everything is hurt. It can't be, a knee problem or a back problem.
Yeah.
Because you go to the doctor and he doesn't find anything.
Yeah. There are many conditions where people hurt really bad, and we take them through the current tests we have. X-rays, MRIs, blood work, whatever, we don't find much wrong with them. Before I answer your question, I just want people to stop and think for a second. Can you just imagine how that must feel for somebody? To have pain and nobody finds it and nobody believes you. So we need to remember that. What I want you to understand is that pain is very complex. Many things can cause pain. When life gets busy, we have a lot of emotions, it can charge our system up. What we now know in fibromyalgia, one of the things happen is our immune system, which typically takes care of us and makes sure we're healthy, in some people their immune system actually ramps up a little bit to protect them. And it's almost the same thing as the flu, we get sensitive all over the body. A, it does happen. B, it can happen, and we can treat it. It doesn't have to be driven by an injury or a disease. Fibromyalgia is nothing else than somebody that comes to us and say, I hurt all over my body and I'm tired and I cannot do this and I cannot do that. The labels don't help us much because we can keep adding labels. Chronic fatigue syndrome, fibromyalgia, we can have all these conditions, but your body is just trying to protect yourself by trying to ramp the system up.
And telling people about pain will take the threat.
Yes, and so we have studies we've done in fibromyalgia. Remember, with pain comes fear. With pain comes anxiety, stress. By teaching people that, A, this is how pain works, what's happened to you is normal, we can explain it. It's not fun, but it's normal. Mm-hmm. And by the way, these are a list of things we can do to get the system to calm down. It creates hope. It gets the system to calm down. So yes, by learning about pain, we find strategies to help ourselves. The system calms down. There is a saying in behavioral medicine that says the fear of pain is worse than pain itself. And so that's what happened to a lot of people. They have pain, but they're afraid of pain, or they're afraid of more pain. And all it does, it just makes them worse. So by addressing their fears and their anxieties, we can actually control their pain as well.
Do you have a last advice for people with chronic pain?
Yeah, I mean, for chronic pain patients, it's hard. I think my advice to them, I think the first thing I would probably say to any person in chronic pain is, I'm sorry. As a medical community, we have not helped you. And I think it's time somebody apologizes. The medical community owes people in pain an apology. We're sorry, we hurt you, we haven't helped you as much as we can, but we're trying as much as we can. My advice to them, this may seem in line with what I just told you, my advice to them is keep moving. Motion is lotion. All the research shows those people that do less and less and less, they don't do well. Keep fighting it, keep working through it, a little bit often. There's a famous quote by the guy that started all of this stuff, Louis Gifford, and he said, start small and just keep adding. Start small and keep building. Start small and start somewhere, do something, and just keep doing a little more every day.
Do you know which profession will be the best one to go if you have chronic pain? Because here
yeah.
we have, you know, osteopaths and chiropractors and Chinese medicine and naturopaths and everything.
I think it's a hard question. I am biased based on my background, so I'm going to answer it two ways if you don't mind. First of all, the answer, I don't give the answer. I'm privileged enough to know that the smartest pain scientist to ever live in the world, who was an MD, PhD, the smartest guy ever, Dr. Patrick Wall, he, before he passed away, said that physiotherapy is the best profession because they combine education with movement, which is what we're talking about today. I'm going to answer it another way in saying, sure, physiotherapy is a good profession, but sometimes it takes a village. It takes more people. Sometimes it would be a physio with a dietitian, with a psychologist. So sometimes we need a few more hands. But the combination of education and movement is going to be critical in the recovery. And now we're talking obviously about a little bit more multidisciplinary, which is okay. But one profession doesn't have the answer. I can tell you that. Pain is too complex. But a combination of those two seem to be by far the most important.
Okay. Thank you, Adriaan, for sitting with me and answering my questions.
No problem.
Adriaan Louw, thank you.
Sure.